Hello, everyone, and thank you for joining us. My name is Helene Ortman, and I'm a volunteer on this year's Film Festival Screening Committee. With me on Zoom to discuss on this happy note is Dr. Marissa Slaven, a palliative care physician with 30 years experience caring for patients and families in our community, and an amateur screenwriter herself. Dr. Slaven, it's a delight to welcome you. Should we dive into this interesting documentary?
Sure. Thank you so much for inviting me.
It's our pleasure. I'm so interested to know what your first impressions were of On This Happy Note. And I'm going to give you a bit of a tall order because I'd like to hear your three perspectives as a palliative care physician, as a regular moviegoer like the rest of us, and as a screenwriter.
Sure. All right. Well, I think my first impressions of the film were that I was blown away by it. I really enjoyed every aspect of it and have watched it several times now. So I'm way beyond first impressions. You asked for my three different perspectives on it. And I know we'll go into more detail about this, but certainly as a palliative care physician, I thought it was a very open, honest, and unique discussion of something that I see literally every day in my practice. So that was just so refreshing to see up on the screen, and I think has potential to be very impactful. As a screenwriter, and I think about first impression, I'm very, very conscious of first impressions, to the point of not only of the whole film as a whole, but how does the film open? How do we see things as they open? What are the choices made there? Because there's endless possibilities of how to open something, right? And so paying attention to that, specifically in the opening, there were a few things that sort of stood out to me. The very first lines that we hear are just a second, just a minute. And then Anat says that's something they would only say in Israel, just a second, just a minute. And I thought that was very important as a beginning point for two reasons. One is it sets the cultural context. And again, we can talk more about that. But right away, it's putting us in a place, right? In a culture and in a place. And the second is that it's a reference to time and, in fact, to how short and how quick time is. And time is another really important theme in this movie. So I thought it was quite the choice of the opening sentence. I'm someone who's very much driven by the characters or the people in a film, whether it's a documentary or a fiction film. And so I'm interested in how we meet each of the characters as well. What are our first impressions? And I'll start with the other people and circle back to Anat, because I almost feel like that's the most personal thing for me. But the first time that we see her daughter is after Anat has passed, and her daughter is looking at pictures of her mother, and her daughter looks very, very sad. She's not crying, but she certainly looks like she's grieving. The first time that we see her husband, Giddy, he also looks very sad, and he talks about, her daughter talks about, her daughter says, even though in my house we talked about dying all the time, we joked about it, it doesn't make it any easier for me. So she's talking about her struggle of grief. And Giddy, Anat's husband, talks about how he imagines, this is again his first lines where we see him, how he imagined growing old with her. And obviously that's not to be. So our connection to them is immediately empathetic and compassionate because they're so clearly grieving. The other person was her good friend Edna. And so I was paying attention to that as well. And, friends sort of sometimes in the grieving process can be pushed to the side a little bit. It's like it's about the family. And so Edna's first statements are about how she and Annette were in love. They were friends on the side, friends with benefits, and to really remind us of how deep that connection can be to a friend, that's a kind of love also. So sort of everyone that we see around her, we're introduced to, they're in their own grief at her loss, and it's very empathetic. Annette, when we first see her, comes off as sort of very calm, cool, and collected, and is that way, I think, for a lot of the movie, and we can talk about why. But I immediately connected with her, and here's where it gets more to the personal. I mean, she's a Jewish woman, I would assume roughly around my age, and she starts off by saying, well, death is the most natural thing in the world. And of course, that's my lived experience also as a palliative care doctor for 30 years, is that death is the most natural thing in the world. And then she says, but it's life that's really a miracle and that's exceptional when you think about our bodies and our blood vessels and the fact that we're alive. And that's the feeling that I've always had since I first studied science. And then when I studied medicine, is like, it is really a miracle that we walk around all day, every day, pretty healthy, and she's a screenwriter, and she did screenwriting, and I do screenwriting. So in all of those ways, I totally connected with her, where I could see that other people might not. So my first impressions of the movie, sort of on every level, were, this is amazing.
That's wonderful. You've given us such a fulsome lead in, I think, to this documentary. And given me even more things to think about and things that we can tease out as we pursue this interview. The documentary is a category of film that doesn't really have to justify dealing with concepts like reality, authenticity, integrity, morality, and ethics. Which of these do you think the film covered, and to what effect?
Well, I think it's interesting, the idea of a documentary in terms of authenticity and reality, because on the one hand, yes, it is real. It's true. Everything that you're seeing is true, but it's also sort of a subjective truth, even though it would seem to be more objective because it's a documentary. There are still a million choices that are made of which clips to show, how to order them, what are we showing and what are we not showing. For example, the whole time that we see Annette, she appears quite well and quite healthy. That's a choice. We also see her smoking a lot. That's a choice. So, it's authentic. It's a version of reality. It's certainly not the whole of reality, right?
All right.
And so that's sort of, I think, for any documentary, what the truth is. And this just gives us an opportunity to kind of point that out.
You might almost say that the film is somewhat idealized.
Yes, I would agree with that. In many aspects, what we see is an idealized version, an intellectualized version, also a beautified, prettied up version of the truth, right? Nobody's fighting and nobody looks sick.
Yes. I've got a big question for you.
Sure.
In your view, was this documentary a realistic portrayal of a person in end stages of life?
Well, yes and no. I mean, clearly she was somebody with an advanced cancer, so it is real. And many of the things that she expresses, I've had many patients over the years express in bits and pieces. Maybe not one person express everything all together the way that she does or the way she's thought out. So in everything that she's saying, I feel the reality of it. I guess where it loses me in terms of, is this realistic for a sick person, is again, we never see her looking sick at all. And, people usually don't look the way she looks right until their very end. They look sicker, they feel sicker, they are sicker, unless we're talking about something like medical assistance in dying, in which case you might look like that right until the end, but different scenario.
Uh-huh. One thing that was especially interesting to me, and you mentioned it earlier, was that Anat remained relatively unemotional
Mm,
throughout the film, almost surprisingly so,
yeah.
especially to someone perhaps outside of the healthcare profession. And in fact, some of the only emotion was really shown at the end, and more so by her husband and her best friend. Do you think that's typical?
Um, I think it is typical to an extent, and I'll explain. And I also think it has a role specific to her. So typical to the extent that, you know, it's quite common when I see patients and families in my office that they don't show the emotion, right? That it's a very private thing and they hold it all together. And it's only once you're at home or in private or in the middle of the night that you sort of let the emotions get out. So I think all patients and families probably have this balance of times when they're more able to deal with it and be more rational about it, and times when they're more emotional about it. So I think it is realistic. I mean, on the other hand, I do have patients every day in my office who are crying, and that's normal too. Like, why
Mhm,
wouldn't you cry? I mean, it
mhm.
seems like the perfect situation to cry or yell or be irritated. And I tell my patients that as well. So I don't think there's a right emotional response to it necessarily. And it's sometimes it's about how much we want to show the world. I think the thing that's interesting and to me, again, speaks to the truth and authenticity of Anat was, again, for my screenwriting, I'm always looking at the timing of things. And right in the middle of the film, there's a little story about Giddy making ketchup, right?
Yes.
And it's like, oh, that's a very cute, funny story. I wonder why they put that in there. And why did they put it in the middle of the film? And what happens when he makes the ketchup is that Anat gets very upset because of the big mess. And she talks to her friend. And Anat then says to her literary agent, you know, the thing that helps me when I'm really upset is writing things out. And then I can turn something negative into something positive, right? And that's sort of the key to this movie. We see it right in the middle. That's how she copes with things, is by writing it out.
Right, right. And also, she made a very conscious decision, and she talks about it enthusiastically, about not being afraid of death.
Yeah.
And that in not being afraid of death, that means she doesn't really have to be afraid of anything else. Your comments on that?
Right. Yeah. Yeah. I think that certainly not being afraid of death is something that only the dying can speak to, and not everyone who's in that, you know, who's in that situation feels that way. Many people who are dying still feel very, very afraid of it. And for those of us who aren't yet in that situation, I think it's nearly impossible to imagine, you know.
Mhm, mhm. At the very beginning, you used the word unique. The film was unique. And in talking about Anat as a person and a person who is dying, she's absolutely unique. And I think that just goes to the whole perspective that everyone is an individual.
Yeah.
And this is her perspective and her approach. And it's something that we have the benefit of viewing through
Yeah.
this documentary.
Yeah.
A documentary can and does expand knowledge and learning. As a palliative care physician, did you learn something from this film?
I mean, I would say for myself personally, not so much, again, because I've been doing this for a long
Mhm.
time. But that said, I think that there is a lot of potentially excellent learning material here for the lay public, as we call them,
Yes.
but also for healthcare providers. You know, I think many of Anat's experience are sort of very eye-opening to healthcare providers to think about how she's feeling. She talks about when she was going to meet with the doctor after the colonoscopy, she wanted to go alone.
Mhm.
And, you know, I think we tend to think as doctors like, oh, you should have your support person there with you. And not that that's a bad idea, but there's also this recognition that sometimes patients want to, like Anat said, be able to ask the difficult questions without worrying about their loved ones in the room and how they're going to feel and how they'll be upset. So that's just an example of sort of one teaching point that if I was showing this to a student, I'd say, like, let's pull that out and talk about that. And how would we integrate that into clinical practice? There are many points like that throughout the movie.
Yes, yes. A bit of a leading question. How do you think this film would challenge viewers and or open their minds and hearts?
Yeah. I mean, I think that, look, first of all, as Anat said, we're all going to have to deal with our own death at some point. Nobody gets out of this without dying. And we all, for the most part, have experienced someone being sick or dying. And so we sort of have options with that. And one is to hide from it and cover it up and not talk about it. And I think if that's sort of the road that you've chosen, seeing a film like this would be very challenging as a viewer, right? But then I think the other option is thinking about, well, how do I deal with my challenges? Because this is going to happen. So Anat deals with her challenges by writing them out.
Yes.
We all have different ways of dealing with our challenge. So I'd say if this movie presents a challenge to the viewer, it's an opportunity for them to explore what are their strengths in dealing with challenges when they arise.
And in that we've got this incredible benefit of you being a screenwriter, let me pose the question again so that you can speak to the technical aspects of the film. What makes it challenging to watch?
Yeah, no, it's very challenging to watch on many levels from the screenwriting perspective. I mean, okay, first level, timeline, it's not linear, right? It doesn't start with she's born, she grows up, she does this, she dies. It doesn't even start with she's dying and then go back to the beginning and follow a linear time. The timeline is all over the place. So that's a challenge. You know, for a viewer, certainly, and makes it much more interesting as a screenwriter to figure out sort of the order of things, and the timeline is how do you make those choices is very interesting. It's additionally challenging because, again, you could just have a one-on-one interview with her for 1 hour and talk through all the stories, but that would be visually kind of boring. And even auditory might be kind of boring to just hear two people talking back and forth. So visually, they had a lot of what we would call B-roll footage, a lot of great photography and other scenes. And so that was great. And I think really helped the film. Auditory, to me, was sort of the most challenging in a way, because it was wonderful how they interspersed her writing, her plays, her different things that she'd done with the actual interview and the story. But sometimes I was like, oh wait, that's from her play. That's not her or the interviewer talking. That's the character in the play talking. And the additional fact that even though I understand some Hebrew, not enough to have watched this film in Hebrew, so I needed to be reading the subtitles while I was watching and trying to figure out who was speaking, and so that was a challenge for viewers as well, for me.
That's great. That's really open, helpful insight, I think, for those of us who are not screenwriters and feeling that there is a complexity, a layeredness to the film, and it just helps us understand that. Now, you may have slightly or partially answered this, but I'd like to put the question to you perhaps again, and it is, what might you say to viewers who were made uncomfortable by this film? And I guess I come at that because in my working life, I had the opportunity to have conversations with patients and families, not that I was a clinical person, but working in another capacity. And I had that privilege and opportunity to speak to people who, in some cases, many cases, did have cancer and who might have been in various stages of their journey. It's not an easy thing. And our viewers are coming to this film seeing it for the very first time. So there's not a lot of context to it, and they're faced by the film, and people could feel uncomfortable, to which you might say,
Yeah. I think, as you said, we've talked about this a little bit already, but I think there are other moments in the film also that speak to this. So one thing is her literary agent is also sort of uncomfortable and expresses that right at the beginning of the
Yes.
film, right? Like in my family, we didn't talk about such things. And so I think for the viewer, that immediately gives you sort of an ally, like, oh, there is somebody else uncomfortable here. The person.
Right.
So I think that's reassuring as a viewer. When you feel uncomfortable, to feel like the person asking the questions he's almost asking on your behalf. You know what I mean? Like if you had the chance to really sit and think about the questions you wanted to ask, that's what he's doing. One of the things that struck me the first time I saw the film, and maybe it was just, it's not strongly emphasized, and because of that, it stuck with me. But I was like, wait, there was some mention about her granddaughter dying, and they didn't follow up on that. And I was sort of left with that. And so in the discomfort of watching this adult woman who is dying, who's not uncomfortable with it, there's also this added dimension of, wait a minute, a child died. And I think that puts things in perspective, of how much worse that is or could be. And again, not one of the first things she says when she has the diagnosis, I thanked God that this was happening to me and not to anybody else, not to anyone in my family, not to my grandchildren. Little did she know after she died, and we don't know what happened to the granddaughter, and they don't really focus on that very much. But I think it's all about perspective and realizing that there are worse things than your own death. Your child, your grandchild's death, dying at a young age, that there are worse things than your own death. So
Yes.
you're uncomfortable, maybe, as Anat said, you're being a little greedy.
Absolutely. To always want more.
Yeah. Yeah.
And why shouldn't we be satisfied with what we have right
Right.
now?
Right. Because the more is not always better. What we imagine might happen is wonderful and idealized, but
Absolutely. Do you feel there's a universal appeal to this documentary outside of the fact that it's obviously Israeli and Jewish?
yeah. Oh, definitely. I mean, I think every single person has to deal with these issues for themselves and for their family members. It's the one thing worldwide you can say is definitely universal, is death and dying and grieving and mourning. So I think for all of those reasons, it would be very well adapted to different people in different situations. You look at the things like, well, what about it might not make it universal? And one of the things I think you and I both noticed was she's smoking all the time.
Yes.
And in our culture, that's not really acceptable. And if you were smoking all the time, you certainly wouldn't put it on film, so there are moments in the film that are not universally acceptable, but the overall themes are so relatable to everyone, that
And I think Annette herself made it very universal when the literary agent asked her about how she felt about religion and God, and she kind of hedged her bets at that. And when he asked her, I think 2 times, she finally said something about, well, it's about being good people. It's about being good. And so I think she really took it out of the a narrow, what could have been a narrow religious confine into something that we all have this capability to be good people, to be a mensch.
Yeah, I agree.
Right. And that would make us happy.
Yeah.
Documentaries can create social change or impact. Do you think On This Happy Note was successful in doing that? And if so, how?
Yeah, I mean, I think it definitely has the potential to be that, if it can be shown widely, so that people can start to have these discussions, can feel comfortable talking openly about death and dying, about what they want and what they don't want and how they feel about it. I think it could have great impact that way. I think, as I said before, it can have impact if healthcare professionals are watching it, with support and education around it. I think it's a great potential tool for opening conversations and for people at every level to learn something.
Mhm. And not in any way preachy at all, but there was that information that she did not have earlier screening, and
Mm,
that perhaps had she been screened because of the hereditary situations in her family, her mother and father,
yeah.
might she have been able to avoid a terminal diagnosis of cancer?
Oh, yeah, absolutely. So, I mean, aside from the whole death and dying thing, if there was something else to take away from it,
Yes.
that's huge to encourage people towards getting their screening done. Because I don't think that she was exaggerating when she said if she had been screened and they caught it earlier, the outcome would have been different. Like from a medical
Uh-huh.
perspective, I think that she was telling the truth there. And so, I mean, I think we're lucky to live in a place where we get reminders. Like I get reminders to go have my mammogram. But a lot of times, even if you get the reminder, you might just throw it in the mail like, oh, it's junk mail, right? And
Mhm.
so you have to have a system that takes care of screening, but even the system is not enough. You personally have to go and take care of it and make it a priority because it can make all the difference.
Right. And another thing in terms of social change and impact, just, how the film pointed out the importance of honoring the wishes of the dying person, the person who is dying, and that Anat had certain goals and certain aspirations about how she wanted to die, and that this maybe was the first time she was doing something for herself.
Yeah, it was very interesting in that regard because when she said that she didn't want treatment, right? Her choice would have been to not have surgery, to not have treatment, and to put herself first. And the doctor said, no, you have to think about your family, right?
Obligation was the word
Right.
he used.
Yeah. And I mean, it's in our Western culture, we'd be like, no, patient autonomy, you first, do what's right for you. And I certainly get her perspective of I've always done everything for everybody else. It's my turn. But I also don't think that the doctor is wrong, that we do still have obligations to our families, even when we're sick and dying. And in many cultures, some Asian cultures, for example, it's you're absolutely still have obligation to your family. Every decision you make is made as if you're part of a family unit, even when it comes to your death and dying. So
Mhm. Anat Gov wanted her conclusion to be a legacy. She wanted it to be the legacy of a happy ending, to die right.
yeah.
Um, how do you how do you comment on that? What did you see?
Yeah. So, I mean, I think the whole idea of legacy is super important. And she does talk about that. And it's something in the medical field that we've come to understand more and more about in general terms
Mhm.
over the last decade or so. So, there's all kinds of legacies, right? She talks about her written legacy and wanting to sort of clear her desk, and
Yes.
she has her literary legacy. Um, there's the legacy of your family, so after you're gone, your family lives on, and that's a legacy. Um, a lot of people who work in psychosocial support in terminal situations help patients with legacy leaving to their children or their grandchildren. If you want to write letters or, leave cards for special occasions. I worked at a hospice where there was an amazing music therapist, and she would help people to create a special song that was a brand new creation that was their legacy for their family. They left the song for their family. So there's all different sorts of legacies we can leave. One of the pioneers in legacy leaving is a Canadian psychosocial oncologist named Dr. Harvey Chachanov, and he pioneered something called dignity therapy, which is about leaving a written legacy for your family of your life. And so finding that patients had greater satisfaction after they'd done this, that they felt they could rest easier knowing that they'd left a legacy document for their family, hugely impactful. her legacy, your question, she wanted to leave a happy ending, and did she succeed in doing that? I guess I feel in a way we don't know, because we don't sort of know what happens when she's dying per se. Certainly at the time that the film is made, she's living a happy ending at that point. Does she get sicker? We don't know. They don't choose to show that. So all it's showing us is the happy ending that she aspired for, that she wanted. Right.
I just want to thank you so much, Dr. Slaven, for being with us, sharing your insights, sharing your expertise, for helping us to understand and reflect on what I really believe is a very interesting, but also complex, complicated film. A film that I think requires many viewings, actually, to tease out different meanings. We also want to extend our sincerest thanks to all of those of you who are viewing on this happy note, and for supporting this very wonderful Hamilton Jewish Film Festival. Thank you again.
Thank you.